Hello, I'm Nick Majerison and this is TopMedTalk's Top 10. That's right, we've compiled some of the best podcasts that we've done here on TopMedTalk in terms of downloads. But before we get into that, I just want to quickly tell you our Editor-in-Chief, Monty Mythen, is currently at Dingle 2018, the 20th Current Controversies in Anaesthesia and Perioperative Medicine. We'll be bringing you updates from the conference over the next week or so. We've already heard it's been a hugely significant conference and expect some updates soon here on this podcast feed. Oh, and also, before we get involved in today's podcast, I also want to tell you that we're going to be covering the American Society of Anesthesiologists, the ASA meeting in San Francisco on the 13th to the 17th of October. So make sure you go to our website, topmedtalk.com, to see when and where we're going to be live streaming from. topmedtalk.com. Oh, and it's worth mentioning as well that you can contribute questions via slido.com. Now, the event code that you need to put into the little box there is hashtag TMTASA18. So if you go to the Slido website, that's slido.com, and then pop your little event code, the sort of the login thing, it says hashtag TMTASA18, which is easy to remember, isn't it? Top Med Talk ASA 2018. So hashtag TMTASA18. If you put that into your event code, you then get access to the Slido questions area where you can submit a question which will be tackled on stage during the presentations at the ASA 2018. So slido.com. I'll tell you more about the end of the podcast as regards how you can sign up for our email updates so you can always be a part of our live conference coverage. Anyway, time now for today's podcast, and it is a huge one in terms of downloads, and you can see why. It's fascinating content. It is titled Patients Are the Experts in Being Patients. It's the penultimate part of the first ever roundtable discussion hosted by Desiree Chappell, featuring Monty Mythen, and recorded on February the 9th, all the way back when Top Med Talk kind of officially launched, really. I mean, we started a little bit before then, but we went for the hard launch at the beginning of the year there. And this is the final segment of that fascinating discussion, which I highly recommend you delve deeper into once you've had a listen to this. Shawna Butler and Jennifer Brandon. Shawna Butler works with the Singularity University in Exponential Medicine, and Jennifer Brandon, who is at the Hoag Orthopedic Institute in Irvine, California. It's an absolutely fascinating conversation. Innovation as a team sport, and it's one of the most downloaded podcasts we've ever had here on Top Med Talk. Have a listen to see why.
Top Med Talk.
Shawna, one more point that I wanted to kind of address while we were talking about this, innovation as a team sport. You gave that lecture today. So can you tell us a little bit about what you were talking about?
Yeah, the problem that we were solving on today was one that Nurse Navigator presented, where she was working with their team to try to get patients moving 12 hours after surgery. And so as we're sitting around talking about this, the insight that was given was that, well, patients are scared and we haven't set the proper expectation. And one of the participants there put her hand up and said, my daughter just recently went through this type of a surgery. And let me tell you, she was scared. She went on and on and on. And I said, the interesting thing about this is that as we're sitting around this table trying to solve a problem for a patient, we don't have a single patient here to help us understand what their insight is. So when we talk about innovation being a team sport, in order for us to really understand how to solve it, we got to have everybody who's participating in that participation chain, the value chain, the stakeholders. So when you think about all of these different things that we're going to be doing, the experts of having the problem, oftentimes, well, more than often, we're at a healthcare conference. I'm at a lot of healthcare conferences. Rarely do I see the experts in the problem in participating in the conversations. So when I say it's a team sport, we're innovating on behalf of and with the people who are enduring and suffering a certain problem. So why are they not there informing us what is it like to go home 12 hours later and to be faced with, I can't get up, I can't go to the restroom by myself, I don't know how to get my pants up and down, I'm not sure about all these medications, who's going to go grocery shopping. Really practical elements that if you're not in that situation, you don't really have an understanding. a lot of the solutions that people were suggesting would require that you'd need, we talked about gamifying. How do we motivate people to do that? Well, the experts in that are the people who are developing games, the gamers. So if, what would happen if you had folks that were experts at Minecraft and building communities together to help you think about it? So one of the other pieces is that when you're thinking about post-operatively, what are the clothing that you need so that you can get in and out of? So where are fashion designers? Where are material scientists? Where are people who actually look at materials that people feel comfortable and can move around in? So when you're thinking about it as a team sport, traditionally what we do is we go right into the acute care environment and say, help us solve this problem. Well, the problem is across the entire experience of when we're not sick, when we are sick, and when we're recovering. So who are all those people that are participating in this? The other part about the team sport that I thought was really fascinating is, again, when we're thinking about solutions, somebody said, well, how like when you're in Disney and you're going on a tour or you're going on one of the rides, you have somebody there that's greeting you and taking you through this entire journey. So what was interesting is that they took a solution that they saw at a theme park and said, well, why couldn't we be using this? So again, what happens when you put nurses with social media mavens, or you put pharmacists with data scientists, or you put an engineer, with some of our rehab folks, and we put people who are specialists in creating 3D printing, with anesthesiologists who are looking at how do we have you breathe better. These solutions come forward when you've got a mix of skill set, a mix of perspective. So that's my point. There are a couple of points about innovation being a team sport, is that in order for this to work, we got to have a lot of different perspectives so that we're looking at a lot of use cases. And then in order for it to work, people need to have buy-in. It's like, well, you're not understanding the material supply chain. How do we actually get procurement? And then if you're not talking with people who are right at the bedside to say, well, look, we've got to explain this, but half of my patients speak Spanish. That was one of the other things that came up today, is that one of the hospitals, we had one of the surgeon who was from London, Guy's Hospital. They said that in their hospital, there are 130 languages spoken. So in order to do any of their care, when they're sending folks home with post-op care, most of it's done in English. So again, that team sport, if you don't have, I actually had this really interesting case where we were doing innovation, as like I said, as a team sport, with parents. So they had kids who were going home, and the parents did not speak English. And so how do you explain to a parent what that medication schedule looks like, what the dosing is? And it was one of the sign language folks that is at the bedside and does sign language, but they understand the value of, we use pictures, we do it visually. So they prepared all of their post-op instructions to go home visually. So they were language agnostic. As long as you could see, you would know this is how much dose. They would draw a picture of the clock, this is the time, and it reduced the medication errors with kids. So it's, like I said, having somebody who was a translator there who spoke sign language had the best insight about what we needed to do for post-op instructions. So that's when we talk about it being a team sport, having a lot of people playing together as a team, and having buy-in for that process.
TopMedTalk. Couple of things to tell you before we wrap up here. Our editor-in-chief, Monty Mythen, as I said at the beginning of this podcast, is now at Dingle 2018. If you're there as well, pop over and say hello to him. He's a very friendly chap. And it's the 20th Current Controversies in Anaesthesia and Perioperative Medicine Conference. We're going to be bringing you updates from that conference over the next few weeks. And we've already heard it's been hugely successful so far. And I'd be remiss if I didn't mention to you that we're going to be covering the American Society of Anesthesiologists, the ASA, meeting in San Francisco on the 13th to the 17th of October. So make sure you go to our website so you can see when and where we're going to be live streaming from there. Whilst you're on the website, sign up for our email updates so you can always be part of our conference coverage. All easily done. Just get yourself to the website, topmedtalk.com. That's topmedtalk.com.